So, distinguished delegates, colleagues, ladies and gentlemen, good morning and good afternoon. Welcome to the first virtual webinar that starts paving the road to the sixth edition of the Border Management and Identity Conference, the BMIC, that has been rescheduled, as you all know, for December 2022. If you are here today, is because we all are friends of the BMIC, which is co-organized by APSCA and the International Organization of Migration. And as you all know, due to the COVID pandemic and developments and travel restrictions around the world, the sixth edition of the BMIC has been postponed several times. Experts and international organizations to keep developing and keep adapting the topics of the BMIC in order to stay on step with the times. That's why we decided to organize these virtual webinars, where we will start discussing some of the key topics that will pave the road to the virtual events that will occur in the course of the 2022 until when the in-person event will happen in December 2022. As you already know, I'm not here alone today. I would like to give the floor now to Greg Pott for his introduction and remarks. Over to you, Greg.
Thanks, Donato. So, ladies and gentlemen, those of you who don't know me, my name's Greg Pott. I'm the chairman of APSCA, and APSCA has been co-organizing this event, the BMIC, with IOM for quite a number of years now, since 2008. So today we are beginning the first of our webinars leading up to the road to BMIC. And I think we've picked a particularly important subject for today's webinar. The subject of digital health certificates for cross-border mobility was important anyway, and it's definitely something that we need to discuss, because there appears to be so many ways to approach this. But with the announcement of a new variant, this webinar seems to be even more pertinent than it was before. So I think now we're going to kick off with the webinar, and I'm going to pass you back to Donato, and he's going to introduce the first of our speakers. We have 4 excellent speakers here today, and Donato will introduce them. They will make their brief presentations one by one, and then we will come back to you with both myself and Donato and all of our speakers in the panel discussion following all the 4 presentations. Donato, over to you.
Thank you, Greg. Yes, excellent speakers today. We have 4 speakers from different organizations in the world. We will start with the presentation on the digital documentation for COVID-19 certificates, presented by an excellent speaker that will introduce himself. And then we will have also IATA Travel Pass, Common Check, and the EU Digital COVID Certificate. Maybe we can start asking the presenters to introduce themselves. Maybe we can start from Nat. Please, Nat.
Sure. Hi, everyone. My name is Nat. I'm a technical officer at the Digital Health and Innovations Department at WHO, based in Geneva. It's great to meet all of you.
Thank you very much, Nat, and welcome. Vinup, do you mind to follow?
Hello. Good morning, good afternoon, good evening. So my name is Vinup Goyal, and I'm the Regional Director for Airports and External Relations in IATA. And in case you're wondering, I'm standing in for my colleague who was supposed to present, but unfortunately could not do so. So glad to be here.
Thank you very much, Vinup, and also thank you for stepping in at the last moment. Paul?
Hello, I'm Paul Meyer. I'm the founder and president of the Commons Project Foundation.
Thank you very much, Paul. And now we give the floor to Michiel.
Good morning, everyone. My name is Michael Swerts. I'm a policy officer at the European Commission and a member of the EU DCC team there.
Excellent. Big welcome to our speakers. And now we can present a little bit the agenda. Let me just ask to my colleagues to upload. From my side, I can't see the slide, but if you give me the green light, I can move on with the brief description of the agenda. Greg, can you see the agenda on the screen?
No, I can't. Well, no, I can now. You go ahead, Donato.
So we will start with a Nat that will speak about the digital documentation of COVID-19 certificate, the DDC, and then we will give the floor to Ayata for the Ayata Travel Pass, and then Paul will speak about the common check, and last but not least, Michiel will speak about the EU digital COVID certificate. Without any further ado, I would like to give the floor to Nat for her presentation. Nat, the floor is yours. In the meantime, I would like also to ask the participants to please interact with us. Don't leave us alone. If you can also start by maybe giving a quick hello in the chat box, giving your name and your country of where you call in. Also, if you have any question, you can type your question in the chat box. And if your question is long, or maybe it requires some introduction or background, feel free to ask for the floor, either by typing your message in the chat box, or maybe by using the hand function that you have on your screen. For any technical problem, do not hesitate to let us know, and we will try to solve it. Nat, the floor is yours.
Great, thanks, Donato. So moving right in. So as WHO, we've essentially been looking at this topic a lot, as you can imagine. And I think it's really important to understand the whole context and challenges around these digital certificates. It's really not just about border crossings. I know that's the interest of this group here, but just to understand why there are a lot more complexities there. So at the global level, there is an inconsistency in terms of what data is collected and what interoperability standards are for. I think this is the one problem that everyone recognizes, is that if you get a certificate issued in one country, it's not easily verifiable or read in another. And also, more importantly, the policies and the science behind all this is consistently changing. As mentioned, with the new variant, it's debatable whether or not vaccines would be sufficient, or maybe testing would also be required. All these things are changing all the time. And so whatever technology is adopted globally needs to be able to accommodate for those changes. And then also, lastly, that global standards require global cooperation, and interoperability really stems from interoperability of people. I think this is the biggest lesson learned that I personally have done throughout this project, is that this work isn't really just about the technology, it's really about the policies and the cooperation across member states and across industries to be able to work together to come to this consensus on what should work best. And obviously these global level challenges have led to very real challenges faced by individual governments, whereby now there are numerous competing products for digitally documenting vaccination status and test certificates. And there's a high opportunity for the private sector to potentially monopolize these solutions. And there's a lack of criteria for assessment for these solutions or specifications for product development. And so now governments are needing to choose between a number of competing standards with slightly different functions and slightly different data protection governance measures, which could potentially lead to undermining confidence of what exists out there. I think this is especially critical for a lot of low and middle income countries, whereby now there are a lot of standards that have been developed in high income settings. And now there's a need for those countries that maybe not have enough resources to try to accommodate the needs from all those other countries as well. And most importantly, I think this was a lesson learned from the Ebola epidemic as well, is that investments need to be aligned with existing digital health strategies. It shouldn't necessarily be something that's one and done, because it is an expensive investment to build these infrastructures. And so being able to invest in digital tools and solution countries should really think of it as a systematic approach to these things. And obviously this leads to individual level challenges, with which I think all of us on this call can probably relate to a certain degree, whereby in some countries, your rights as an individual are limited depending on your vaccination status or your test results. There's potentially fraudulent paper and digital certificates that exist out there. And there's also a lot of confusion about where to get these certificates, what's accepted, depending on where you go, what you need to go into that country. And so the objectives of the digital documentation of COVID certificates guidance that WHO is working on and has published for the vaccine status is to publish implementable specifications and standards and key considerations for countries in terms of data representation, functionality, and national trust architecture. So it's really about developing guidance for member states, not necessarily providing a prescriptive, this is what you must do, and ensuring that the design of these technologies is in a format that is accessible to all and doesn't lead to any sort of vendor lock-in for those countries. So I just want to quickly clarify too that these documents that we've been publishing are really focused on the technology aspect, but the policy aspect do exist in other WHO guidance as well. So I would recommend looking at all of these things in together. And so the DDCC specifications cover multiple use cases as well. So the one that has already been published on vaccination status, I think for a lot of those in this group are really concerned about the proof of vaccination. So being able to prove that someone's been vaccinated for whatever travel purpose or access to public spaces. But one that actually is really critical for us as WHO is also the continuity of care purpose. And so as you have a digital certificate, it should be able to allow for individuals to have a record of their own vaccine status, as well as understand when they need a second dose or when they need a booster dose, and it's really part of their overall medical history. And it's really critical to keep that use case in mind as well, because that's really the public health use case that is critical for us. And the secondary benefit is being able to then prove your vaccine status. So that has already been published. And so now we're working on the DDCC test results, whereby we provide guidance on how to digitally document a negative test result or a positive test result, which can be used as a proof of previous SARS-CoV-2 infection. And so in the document, I won't go through all of this, but we did outline some design principles that we recommend member states follow as they're looking at these different solutions. And so I think the primary one that's really critical is that they really should not increase health inequities or increase the digital divide. I think this is critical for any digital solution that's implemented in countries, and to ensure that people aren't left out simply because they do not have access to a digital tool or device or anything like that. And I think another thing I would also want to highlight is that it should be environmentally friendly as well. Again, the challenge with all digital solutions, but I think critical to keep in mind, especially given the scale that's anticipated for these digital certificates to reach, to ensure that whatever technology you are implementing is mindful of what the impact on the environment is. I think we've seen a lot with blockchain-based solutions being proposed to member states. And in some countries, it can work great, especially in high resource settings where there's full connectivity, very reliable electricity resources. But this may not necessarily be feasible in a lot of countries that already have instability in terms of their electricity. So to keep those things in mind as well. And of course, to ensure minimization of the health data when it's not related to health care. So going back to the use cases of continuity of care versus proof, for continuity of care, there is a lot more data because health workers need to know your full health status to be able to provide appropriate care with the right quality. But that might not necessarily be the case for a border patrol agent, for example. And so being mindful of those different use cases and designing the solution so that it would fit all those things. And so just to kind of illuminate what this looks like in practice, we built our guidance off of existing legacy paper-based systems. So vaccine records are based on the ICVP or the yellow card, and also the National Immunization Home-Based Record. So the ICVP is something that's often used for travel with yellow fever vaccines, but the National Home-Based Record is something that some countries might actually also put in the yellow card or have a separate mechanism altogether to denote vaccine status of childhood immunizations. And so we try to build specifications that can accommodate both those use cases in a digital format. And similarly for test reports, you often see you would get a test report from a laboratory or any other setting. And that, again, has a lot of information, but I think the critical piece of that is that it's often not verifiable. And so we have the specifications for the DVCC-TR to ensure that that is verifiable. And it's the same format for both of these certificates where it should be possible to have something that's potentially handwritten on paper, but then have a QR code embedded on it so that that can be verified, or a PDF printout containing barcode, or just a PDF document in general. Or the more sophisticated one would be a smartphone application as well. And so in the document, just again, it's not a policy document. We do list out what the relevant policy guidance documents exist that has been published by WHO in the document there as well. But really the document is more focused on technical specifications and implementation considerations for digital. So it include business process workflows, use cases, core data elements mapped to standard terminology code sets, functional, non-functional requirements, signing a digital certificate with PKI, as well as a HL7 Fire implementation guide, which is a data exchange standard that's often used in healthcare. And it's an open standard as well. And so implementation considerations, as kind of noted earlier, we have data protection principles, ethical considerations, as well as governance considerations for member states to implement. And so the assumptions is that countries should be responsible for taking this guidance and then choosing the modalities in which they want to implement the COVID certificate. Understanding that however they implement it, it should operate with existing or planned point of service solutions. So electronic immunization registries or lab information systems may or may not already exist in the country. And so this certificate kind of add-on needs to account for those things. And most importantly, the policies need to be in place to support this. So not only the policies for the digital, but also for the appropriate use of these certificates. And then countries also should determine which mechanism for unique identification of the individual. We've read the specification to note that DDCCs are not intended to be identity documents. And it's really up to the member states how they wish to, what is often referred to as identity binding to the certificate. This could be either used by Health ID, National Health ID, or passport number, or none. Again, this is up to the member state. And then countries need to determine which trust framework is required to validate those COVID certificates. So that will be agreements that are established between countries, either bilaterally or through regional networks or any other mechanism countries wish to pursue. And just to highlight again, for these DDCC documents, we really are trying to write the specifications as a way to architect for the future. So again, this immediate need for COVID-19 with the certificates, but really we are trying to build off of that so that it can be expanded for routine immunizations for children and also potentially a personal health record that individual can use to carry with them. But again, depending on the use case, not all these data elements would be needed for verification. And just to, I think this is the last slide, the timelines and tools for what WHO will be producing. So as noted, we already published the guidance in late August. And we just finished the call for public comments on the DDCC-TR. So we're currently in the process of taking those public comments and integrating that into the guidance. And by the end of the year, we'll also have a PKI reference software that countries and regional networks could potentially use, expanding off of the EU DCC solution, as well as your universal checking app that's in beta, which can then be, again, used to validate all the different QR codes that exist out there and the different standards. And in January, we'll have a Fire Connect-a-thon to test for conformance, as well as have a digital test result certificate generation service. So the reason why we refer to it as a certificate generation service is because as WHO, we don't specify what the QR code should contain or how it should be validated. And so there can be multiple ways to generate the different QR codes based on the other existing operational specifications that exist out there. And so the last publication is planned for the end of Q1 of next year. I think that is it. Happy to answer any questions. Thanks.
Thank you very, very much, Nat. I was expecting an informative and comprehensive presentation and you exceeded my expectations. I don't know how you managed to summarize all this in 10 minutes. You touched very important aspects that I think and I hope will be a stepping stone for our discussions today. You mentioned about the international standards very much needed in these kind of situations. The responsibilities of the countries, also something that I would like to keep discussing, ethical considerations, and an excellent point here. And then the yellow card, is it possible to have now something, the same type of agreement that countries reached for the yellow card vaccine or the international vaccination certificate? And if countries can digitalize this information, ensuring that no one is left behind. So these are some considerations that we have to take in consideration for the discussions, and I keep inviting colleagues to write down questions for our discussions and start thinking any question for Nat. In the meantime, I would like to also mention some of the colleagues that are online. Welcome from the representatives from Iran, Malaysia, Timor-Leste, Jakarta, Indonesia, the Philippines, UK, and Somalia, Germany. So we have Australia, but UAE from Dubai. So, but there is a discrepancy between the number of good mornings in the chat box and the number of participants that I see here in the total list, which are 85 in this moment. So please, colleagues, just give us your good morning and the country where you're calling in. Thank you very much, Nat. And now we can move the floor to the next speaker. It is my pleasure to give the floor to Vinup for his presentation from IATA. The floor is yours, Vinup.
Thank you, Donato. Just confirming that you can see my screen and the first presentation slide.
Very loud voice and very clear presentation. Over to you.
Okay, thank you. So good morning, good evening, good afternoon to everyone. So I'll just touch upon some of the details of the IATA Travel Pass, building upon the excellent presentation from Nat, in which she laid out, some of the challenges and some of the initiatives related to digital test and vaccine certificates. So just to start things off, from an aviation viewpoint, first of all, COVID has been the most severe crisis for aviation during the time aviation has existed. And while we are starting to see some growth and some recovery and restart, again, we have had some hiccups over the last few days because of the new variants, but we are seeing some recovery. One of the issues that we are facing is the current processes are based on paper. And if anyone has traveled internationally, you have to take a paper test, vaccine certificate, hotel reservation, insurance forms, and others. And what that has led to is that pre-COVID, average time one spent at the airport before departure and on arrival, if you added that up, it was around 1.5 hours. If the travel returns to pre-COVID levels in numbers, that processing time will increase to 8 hours. And that's what this slide is showing. And as you can see, that 8 hours is just not practical in terms of the strain it will put on the system and in terms of some of the risks it poses, because you have people just, gathering at airports, just waiting to be processed. So that is one issue. So from a practical facilitation viewpoint, and the other issue that we are seeing is this whole issue of paper certificates that can't be verified. Unfortunately, you can go on the internet and you can get a fake vaccine or test certificate for just a few dollars. And there is no way for an immigration officer or a border control officer to verify whether that paper is fake or whether it's real, especially for test certificates where there's a name of a hospital and a doctor's signature. How do you verify that? Unless you try and call up the doctor from immigration, which is not practical. So the IATA Travel Pass was something that IATA came up with in response to requests from our member airlines, and it aims to solve that problem. So it has 4 big components. So first of all, it has your digital identity, which you can create using your passport. Secondly, it has the ability to import test and vaccine certificates. It can also handle paper certificates if it can verify them. And thirdly, what it does, it then matches, it goes and checks, okay, where are you flying to? And then it looks at the travel requirements, which are stored in our thematic database. So thematic is a database that I'm sure many of you in the immigration world are aware of. We have enhanced it to cover COVID regulations. So basically, once you have that, you have the secure identity, you have test certificates, you have the rules, you can pretty much verify whether this person is should be allowed into the country or not. And then the last point is that all this information can be shared securely with immigration, with airlines, with airports as needed, and the passenger is in full control of that process. So the trust proposition, which is very important for passengers, for airlines, and for authorities, is it is authenticated. We create the identity from a e-passport or even from a non-e-passport using some authentication tools. It is accurate because we do have this thematic database that's been around for more than half a century, and we have enhanced it with COVID regulations. And then the test results are also only from verified labs. It's not that you can just add any test result into it. So it's trusted labs, and we add vaccine certificates, which are verified as genuine. The other point that I just want to highlight is it is designed to be a decentralized system. So the identity, the certificates are all stored on the passenger's device, and he or she is in full control and can decide who to share that with. There is no central database, there is no cloud where all this is stored because it was designed with data privacy and ownership principles in mind. So this is where we are. We also look at, this is going to be the start of a process. As you know, we have been talking about biometrics and One ID for many years. We are hoping with this, using this tool, is to enable governments and airlines and airports to actually start implementing the framework for a contactless process in the future. And so we are hoping that the future processes will be contactless, end-to-end, based on biometrics. And again, we are working with other providers based on open standards and open APIs, which are part of the One ID consent. So where are we with this? We are working with airlines. We have got interest from almost every airline across the world. Many are trialing it, testing it. A couple of airlines have announced implementations, and hopefully you will see, or you will have the ability to use the IATA Travel Pass. Ultimately, it's a tool or an option that an airline has to offer to its passengers because we believe that you need to work off secure passenger data on flights. So you shouldn't be able to put in a bogus flight and get an okay to travel, but it has to be a real flight, and that's why it has to be offered by airlines. We're also working with governments, first of all, to explain to them what it is, to get their understanding and get the acceptance. Because what we want is them to be able to accept either the IATA Travel Pass or credentials from the pass rather than asking for paper. You could implement all this fancy technology, but if at the end, if an immigration officer says, nope, I don't trust it, I want to see the paper certificate, whether it's a test or vaccine certificate, then we have lost the plot. So, and then we are also trying to see whether governments would like it to be integrated so that they can get the credentials directly from the passenger in advance of the flight, so that they can pre-approve a person's arrival before he or she even gets on a flight. And again, all this data transfer would be based on a passenger's consent. And we are also working with labs across the world to get them on the registry to make sure that they're able to issue verifiable test certificates that are reliable. So that is, in a short nutshell, what the IATA Travel Pass is. You have my name and email out there, and the name and email of my colleague who was supposed to present, Yoon Kim. Please feel free to contact us if needed. With that, thank you, and back to you, Donato.
Thank you very, very much, Vinup. Excellent presentation from IATA as well, and a lot of topics that are, I'm sure, very interesting to be further discussed in our discussions today, and maybe even further. When you presented, I thought that countries in the last 10 years, 15 years have spent a lot of resources, a lot of time, a lot of energies in decreasing the processing time at the border. But now countries had to take 3 steps back because additional requirements are there, and countries need to cope with these additional challenge. Something that you said, and I would like to further discuss in the discussions later, two keywords: trust and confidence. Now, how can we rebuild trust, the same trust and the same confidence that countries already rely in travel documents, now in these additional documentations that are requested? And of course, identity management, a topic that will always be on the table for our discussions. And I hope that IATA will keep presenting these topics in the next in-person BMIC in Bangkok in December 2022. I would like also to have a few chat, I'm sure, in the discussion about a few words about the end-to-end contactless experience. And this is something that I'm sure that also our participants will like to hear. Before giving the floor to the next presenter, allow me also to put on record our colleagues from Japan and Maldives. It's a pleasure for me to see old and new friends here online, and we reached 93 participants. The floor now goes to Paul for his presentation, and colleagues, please do not forget to think about your questions for our
Oh, can you hear me? Okay.
Very well, and we can also see your screen.
Super, great. Thank you so much for having me. Delighted to be here. I want to just first introduce the Commons Project Foundation, which is a nonprofit organization launched out of the Rockefeller Foundation, really with the idea of building digital services for the common good. We believed, this was long pre-pandemic, that there were certain digital services that needed to be operated and filled a void between governments, between traditional nonprofits and traditional international organizations, to build what we think of as sort of digital services for the common good. Before the pandemic, we launched Common Health, which is a platform for Android users, the equivalent of Apple Health for Android users, for people to collect, store, and share their health data. We launched Common Pass last year. It was really one of the early kind of health pass solutions. I'm going to talk about the Smart Health Card standard that we co-developed and has emerged as the de facto digital credential standard in the United States and Canada and other places. And then the Common Trust Network that we operate, which is a registry of trusted issuers, and the Common Check service that I'll speak about and show, and talk about some of what we've learned and building on the two great presentations we've heard already. So I'll talk just a minute about Smart Health Cards. Again, Smart Health Cards emerged out of a working group that we convened about a year ago, when we realized there really was a need to develop a verifiable credential standard for health data. This is based on HL7, which is sort of the standard health data interoperability standards. And this is, I'm sure everyone knows, the United States government has not created a digital credential standard, unlike the European Union, member states, and many other countries. However, the Smart Health Card standard that we developed has now been adopted by most of the key stakeholders in the United States. Many states, all of the large pharmacy chains that are administering a lot of vaccines, all of the largest health systems, and it is emerging as sort of de facto standard. Canada adopted Smart Health Cards as their national standard in October, issued by all of the provinces in Canada. Japan is implementing Smart Health Cards, North Macedonia, Rwanda, a number of other African countries as well. So it is emerging as a certainly one of the leading global standards for, very consistent with WHO standards and guidelines that many countries are adopting. I think it's also significant that it's been adopted by the major mobile phone platforms as their default standard. So Apple supports Smart Health Cards as the default standard for carrying a vaccine credential in Apple Health and Apple Wallet. Samsung similarly allows Smart Health Cards actually through our Common Health app, which is the health wallet, to be able to share a vaccine record in Samsung Pay, the Samsung wallet. So I think it's significant, because I think part of getting adoption of standards is the role of the large mobile platform companies. I also want to just really echo something Nat said. one of the reasons that we're very passionate about this is we're obviously, today talking about reopening borders and so forth, but ultimately our mission is really about empowering individuals to get access and control of their health information for healthcare purposes. And the Smart Health Card standard itself is designed, it's supporting vaccine records, diagnostic test results, but already being used for things like routine immunization records and other health information. It is designed to be an open standard to be able to support health interoperability in general, not just this sort of travel, the travel and border crossing use case that we're talking about today. We also launch and operate what's called the Smart Health Card Verifier app, which is a verification app that is being used certainly broadly in the United States and other places to actually verify smart health cards, to ensure that the credential is valid. And really importantly, it was issued by a trusted source. One of the things that's different, if we'll hear from Michael about the EU DCC, where nation states are the issuers of EU DCCs. In Canada, for example, it's provinces that are issuing smart health cards. In the United States, some states are issuing them, but many hospital systems and pharmacy chains. So it becomes very important when verifying smart health cards from, for example, an inbound US traveler, to know not just that this is a valid smart health card, but it was issued by a trusted source. And so this verification service ensures, again, that it's a trusted credential, but also importantly, it was issued by a trusted source, and that really is critical to maintain trust through the ecosystem. I'm going to talk now about what the new service that we've developed and launched called Common Check, which is really designed for governments to be able to verify the health status of incoming travelers. It's focused primarily on borders and country entry, but I think one of the things that's really important to bear in mind is people need to obviously travel, and countries need to verify the health status. But as many countries have implemented and adopted tools for requiring proof of vaccination for domestic use cases, it's also really important to think about, you want a traveler to be able to come into your country and ensure they satisfy the health screening requirements, but that person then probably wants to be able to go to a restaurant or go to a stadium. And so it's important in implementing these sorts of systems to think about how someone who comes into a country is able to subsequently also be able to participate and do things in the same way that citizens who may have a domestic credential can do so. One of the challenges, there are many challenges to sort of reopening safely. And again, I'm sure most people on the phone on the Zoom call are well aware of these. One of the biggest challenges is the fragmentation of credential standards. There are others, lack of standards, stovepipe, data privacy concerns, and so forth. But this is, one illustration of the different kinds of credential standards, different apps that are out there, and so forth. And so, again, one of the challenges that we see, and the Common Check is intended to solve for, is to be able to verify all of the leading credential types in assessing health status of incoming travelers. The other thing we're seeing, and again, there's just been a sort of a mishmash of different approaches to this. One of the things is, as we heard from IATA, and many of the airlines around the world stepped up to try to help address this problem. Ultimately, our view is this is really fundamentally a government issue. It's not an airline issue to solve. And even if an airline can check that someone satisfies the rules, that's not necessarily going to be sufficient for governments, and one can end up having to re-verify. So what Common Check is, it's an online platform. I'll show it to you in a minute. But basically, it allows governments to set their rules, allows individuals before they begin their journey to upload their vaccination certificates, their test results. This platform checks those credentials against the rules that are set by the country, and then it generates a pass, basically a certificate that Paul has satisfied the rules to enter the country. That certificate can be checked by the airline. It can be checked by border control. It also can subsequently be used to support domestic verification use cases as well. So rather than, I'll just shift quickly. the platform supports all of the, I mean, I think our view is there are sort of four kind of emerging global standards. Obviously, the EU-DCC standard, Smart Health Card standard, DVOC, initially deployed in India, but now implemented by other countries as well, and the ICAO standard. But then, many countries have issued their own national standards. These are, some of the credential types that the Common Check platform currently verifies against. I'll show you, this is, the way it's deployed, generally speaking, is embedded within a country's PLF. So this, for example, is the Cayman Islands, which was, we went live with a couple of weeks ago. So this is sort of in the government portal that is mandatory for all inbound travelers. I skipped ahead to some of the, I'm declaring that I'm fully vaccinated. I'm not traveling with children. I am a tourist. This is just their standard declaration. And then it basically says, do I have one of these certificates? An EU DCC, an UK NHS COVID pass, or a Smart Health Card. If I say yes, it then basically, it will prompt me then to basically verify this declaration I just made by then uploading that certificate. So I will upload, I just browse, I'll pull up, this is actually my New York Excelsior Pass, which is based on the Smart Health Card standard. That is being then compared to the rules, and assuming it works, hopefully it'll work, I will be able to then continue. And then in this case, I'm then given a travel declaration from the Cayman Islands that I have satisfied the rules, and this is then used by border control. That's a version of it that's embedded within a government portal. This is the version that we are piloting with the U.S. Customs and Border Protection for inbound travel in the United States, where there's not a mandatory PLF, and I won't go through it all, but basically what it's doing, it's presenting me with what the requirements are. So I say, if I'm not a U.S. citizen, it says, okay, here are the rules based on the U.S. entry requirements, a COVID test, then a vaccination record. And then, I go through a process, which is similar to the uploading process that I showed with the Cayman certificate. So again, this is sort of what the Common Check platform does. I will again skip through the end of the process. In the US portal is again a similar certificate that says basically I have satisfied these rules that the government has laid forth, and that credential can then be shared by a traveler. So that's really what we're doing. Again, we've certainly learned a lot of the last 2 years in this, but I think fundamentally our conclusion is that doing this verification really is something that does need to be implemented by countries and embedded in their sort of in the border management processes. And then if that happens, then airlines and domestic verification and many other solutions can flow. So I will pause there and look forward to next presentations and answering your questions. And my email is simple. It's paul@thecommonsproject.org. Thank you.
Thank you very much, Paul, for your fascinating presentation, which provides, from a different angle, a discussion about the same issue that we are all discussing about. Let me start by stealing a couple of words from your presentation. In particular, the theme of the Common Check, which is reopening borders, and everyone wants to reopen borders, but safely. Your PPT shows also how the cooperation with the private stakeholders can contribute to the government efforts in addressing different issues, including the issues related to the COVID-19 pandemic. I see big names there: Microsoft, Apple, Cigna, Mayo Clinic, Samsung. But also you address something that I would like really to have in our discussions today, which is the need of verifying the health card, but not only the validity of the card, but also if the card has been issued by a trusted and authorized source entity. Another word that I would like to steal is fragmentation. And I think that all on this chat today agree that this is the first challenge that we all have to start addressing, the fragmentation of the different initiatives that actually does not allow the global standard to be achieved. Last but not least, I totally agree with you, Paul. This is not an issue for airlines. Airlines may contribute to the solution, but the solution should come and shall come from the government. Now, before giving the floor to the next speaker, a warm welcome also to our colleague from Bangladesh. And the floor goes to the next speaker. Thank you very much, Paul. And colleagues, do not forget to think about your questions for the chat that is about to come after the next speaker. Michael, the floor is yours for your presentation.
Thank you very much. And good morning, everyone. It's a real pleasure to be here, or I should say good morning or good afternoon or good evening, wherever you may be. Perhaps I might just be able to start with a brief recap of the objective of this this webinar, which says it aims to deepen participants' understandings of different technologies developed for digital health certificates and how they can be used in a border management context. The EU DCC from that point of view offers perhaps a slightly different perspective because it was not designed with necessarily a border management objective in mind. Next slide, please. So what is the DCC? It's effectively a framework for the common issuance and verification and acceptance of 3 types of interoperable certificates. So vaccination, test, and recovery. And the QR code represents the digital and the digital COVID certificate and is really at the heart of it. And it contains all the relevant data necessary for the verification of said certificate. It is 1 certificate per event. So one dose of a vaccination, for example, rather than a history of a full vaccination cycle. So with each event, you get a new certificate. And the QR code is digitally signed, which permits the essence of the DCC, which is verification, to be able to verify the certificate's authenticity, the integrity and validity. And the principles on which it was designed bring it very much in line with the WHO DDCC guidance that Nat talked about earlier. For starters, it's governed by member states because in the EU, healthcare is a member state competence. So member states have been very much in the driver's seat in that respect. It's a very equitable solution. It's free of charge. It is available on paper and in digital format. The information is both human readable and machine readable, and it's non-exclusionary in the sense that people who cannot or will not be vaccinated have alternatives through the test certificate, and it also caters to people who have recovered and maybe didn't necessarily receive a full course vaccination or no vaccination, but they can demonstrate and exercise their freedom of movement as well. Data protection is highly embedded in this solution in terms of data minimization of personal data and in the sense of non-storage of personal data after verification. And it's a very privacy-preserving solution which does not permit tracking of individuals. And a key focus is on ensuring security, which is accompanied by a very robust onboarding procedure for countries joining the system. Another key principle is openness and transparency. It has been the DCC has been developed according to open standards to enable interoperability, but also it's all open source to enhance scrutiny and accountability. And as such, it allows other countries to benefit from this system. It's a very flexible system, and it naturally has to, because it has to cater to all the different healthcare systems in the European Union and now beyond, and different digital health strategies. So flexibility is ingrained in that, and that allows member states also to define their own validation rules so that they can apply their own healthcare policies. And finally, it's very actionable. Member states can act on the payload in terms of vaccine acceptance, the validity, for example, different test types. And so that makes it very versatile. Next slide, please. So the background to the DCC was that it was developed in a very short space of time. The political announcement was made in March of this year, and we were expected to deliver by summer. And we had already been developing some basic interoperability building blocks prior to that in terms of developing the data sets, the trust framework, the value sets, and so on. But in the end, from the moment that it was announced to implementation was 64 days. But the legal basis of the EU DCC is not rooted in healthcare or in border management, but in freedom of movement, one of the fundamental freedoms for EU citizens within the EU. And during COVID, of course, these freedoms were curtailed for the purpose of public healthcare. And the regulation was adopted in order to develop a tool that could restore those freedoms. Naturally, there were challenges in doing so. As I mentioned, the diversity of healthcare systems, trying to agree on the common purpose of what it was to be for, whether it was continuity of care. In the end, it was decided for freedom of movement, and data protection is a very, very strong consideration in the EU. And of course, public expectations were very high in terms of how do you deal with vaccination, sensitive healthcare data, and the EU itself, politically not accepted everywhere. So next slide, please. So the trust framework in the EU DCC is a straightforward public key infrastructure. So to prevent the fraudulent or forged use of QR codes, we sign the QR code, we digitally sign it using a public and a private key. And those keys, the public keys, are exchanged via national backends to an EU DCC gateway between all countries connected to the system, so EU member states as well as non-EU member states. And those keys can be retrieved into the verification software of each country in order to be able to verify in an offline manner the certificates. And that enhances security and data preservation. So no personal or health care data is exchanged across borders, just the public keys are. And in addition to that, countries can also share their validation rules through the gateway. So that enables the automated reading of the QR codes, not just syntactically, but also semantically as well, so that countries can see, or verifiers can see, whether the certificate meets the local rules in place. And that greatly speeds up not just the verification process, but also the acceptance of the certificates as well. Next slide, please. So the upshot of this system is that in establishing a system that's imbued with sort of core EU values, is that it's become a very successful operational system. More than 700 million certificates have been issued in the EU to date. And beyond the 30 countries initially covered by the EU regulation, we now have 52 countries connected. I know it says 51, but yesterday El Salvador joined as well. And we have nearly 30 countries currently being assessed and for joining the system, and that number keeps growing. But the EU DCC is not a travel document in itself. It's not an entry condition into the EU, but it helps facilitate travel into and across the EU. And it has very much contributed to the direct recovery of the EU's tourism sector, certainly this summer, which is why the imperative was there to have it adopted before the summer. And thus citizens being able to exercise that fundamental right. Next slide, please. So one of the features of the regulation is that it also allows the EU to recognize certificates issued by non-EU countries as equivalent to their own. and to adopt effectively secondary legislation recognizing that as such, so that the countries can join the trust framework. And the open standards and specifications and the reference implementations for the software are freely available on the Commission's website. And many countries have taken advantage of that to develop their national solutions, or even if they have developed their own national system, to add the functionalities to enable QR codes to be produced containing the EU DCC compliant data, and formatting so that EU-bound travel can therefore be done in a way which is equivalent to the EU DCC standard. And we've developed a process which is relatively light and quick for countries to join this system. And then we have a thorough onboarding process to get to test the connection with the countries and ensure that it's done securely. And the advantage of having this enshrined in secondary legislation means that it obliges all member states within the EU to, once that decision is adopted, to recognize those certificates as equivalent, so they need to be accepted. And we continue to develop the functionalities of our system. We have recently developed booking solutions and ticketing solutions, much like what Paul was talking about with the common check, to allow people to have their certificates verified already in the check-in process, but without giving airlines necessarily the obligations that fall under them under the General Data Protection Regulation, so that they don't need to effectively assume those responsibilities, but that they can get the verification that someone has a valid DCC. So it's the beauty of this system is that it easily allows others to join, it's flexible, and it helps restore international mobility. So I'll leave it there. Thanks very much.
Thank you very much for this presentation, very informative as well. But also thank you for presenting on a tangible, practical example of how the agreement among different countries can facilitate international travels and reopening the borders in a safely manner. You also mentioned that this was developed in a short time, which is the confirmation that when countries want, decisions can be taken without any unnecessary delay. But something that is also fascinating from your presentation is that you mentioned that the legal provision for the DCC lies in the freedom of movement principle, which is a pillar, a solid pillar within the principles of the European Union. You also presented on the complex infrastructure where private keys and public keys are of a paramount importance when a document needs to be used in different countries. And here we go back to the trust that we also mentioned in the previous presentations. Last but not least, a clear SOP, standard operating procedures, needs to be in place in order to allow the decision process and what the follow-up steps should be. Now, thank you very much to all the presenters for your very informative presentations. And actually, we started receiving some of the questions, but please keep asking even more. We have some in the chat and some in the private question and answer chat. So now maybe we can ask, first of all, to the colleagues that wrote the question in the Q&A to maybe cut and paste in the public chat so that everybody can read the question, but also if you can start the question by introducing your name and your country of where you're calling in. So Greg, over to you for an overall consideration or reaction after the presentations. Over to you, Greg.
Thanks, Donato. Good job of introducing the speakers and summarizing their presentations. So yes, ladies and gentlemen, please, if you put your questions in the chat, then we will address them. But also, actually, normally if you put them in the Q&A, if you do put them in the chat, then yes, it's true, other people can see them again. But even if they're in the Q&A, we will read them out. I think what I'd like to do is, before we address questions from our participants, I'd like to ask each of our speakers a general question and have them all respond. And that question would be, if you could summarize in each case, how does your solution or proposal help in reopening borders and resuming international travel? And in particular, how is your solution interoperable with other solutions, whether discussed here or not, and any nationalist initiatives which governments might have developed themselves? And how could your solution or proposal become as widely and globally accepted as possible, bearing in mind the issue of fragmentation that was raised by Donato earlier? Can I ask each of our speakers in turn to address that, and starting off in the order in which you spoke? So, Kunat, over to you.
Sure. Thanks. I guess the first thing to clarify too is that the WHO content isn't necessarily a solution. It is definitely a set of guidance that we hope countries can follow. So for example, with the EU DCC, that's an example of a country or a region that has decided to implement according to WHO standards. So I think the first kind of challenges early on in the pandemic, where we found there wasn't any sort of guidance at the global level, that was the gap that we're hoping to fill. But recognizing that there are real operational challenges in different contexts of countries, how their health system is structured, digital maturity, all those things come into play. And so we've kind of provided an umbrella specification of best practices that we recommend countries can then build off of for their specific implementation. So I hope that clarifies.
Yeah, that does. Before we go on to the next speaker, I mean, I'd like to come back to you on this, because one of the questions which we had between ABSCA and IOM when we were developing this webinar is, why are there so many specifications and proposed standards? And before this, as Donato mentioned earlier, we really only had one that was used around the world, which was the yellow book, the yellow paper. And now we've got your own WHO's, but many others as well, as mentioned by Paul. But let's come back to that later. Can I ask Vinu for you to answer the same general question?
Yeah, so one of the things, so to answer your first part of your question as to how a solution is going to help travel or connect the world again, I think from a, I think I'm not speaking out of turn when I say that the biggest issue for governments and for immigration officers is to have confidence that anyone coming into the country is not going to pose a risk. And that is why countries have done their own risk analysis and have put in restrictions which say you need to be XYZ vaccinated or you need to be tested ABC. Now, what our solution, IDRIP Travel Pass, does is it ensures that anyone using that process meets those conditions. So we are into the confidence building business more than anything else, if I may say. And so what we are trying to do is to give passengers a confidence that they have the right credentials and will be able to enter the country. And we are giving governments the confidence that anyone who is using this has gone through the right checks and thus is not posing a risk. And we are also giving confidence to the airlines that people who are carrying on board, they won't be not allowed to enter, and then they have to bring them back. So that's what we are doing. And so our challenge is to make sure that governments and other stakeholders understand that. And one of the things is, yes, there are multiple solutions out there. But then, we have been using electricity for how many years? And we still all use different plugs all over the world. We can't even decide on which side of the road we need to drive on, right? And currently in this crisis, and you have to kind of acknowledge and appreciate that there are different people who try to come up with a solution in the quickest time. And thus you ended up with a few different solutions. And what we hope is they can interoperate. We have modules that can work with other solutions, and they're built on open standards. So if any government, any other solution wants to interface, we can send those credentials in a secure manner. But if the world tries to say, no, we are not going to implement anything till we come across a global standard and one standard, COVID will be long gone before we reach agreement. So the key is for these solutions to coexist, but in a manner that they're not too confusing for passengers and for authorities. And I think that's the balance we need to reach.
Thanks, Vinod. Paul.
Yeah, so really good questions. I think it's really important to separate the different components, right? I mean, there are credential standards for issuing a piece of health data in a secure, verifiable way. And I think, in WHO, there are actually 4 that are listed as sort of consistent with the framework. There's the EUDCC, Smart Health Cards, DVOC, and the ICAO BDS standard, right? So that, then again, many other countries have implemented their own, but I think there are 4 that are sort of, certainly deployed by more than one country. So that's the standard of the credential. And certainly smart health cards are an open standard, but again, not the only one. I think the second thing we're doing, obviously, is maintaining a registry of issuers. One of the things I think is really important, obviously, there's a lot of focus on, countries are issuing, as, the EU member states are. But if you think about, well, certainly some countries are. The United States is not issuing a national digital credential and never will, right? So anyone who is interested in having a vaccination certificate for a US traveler, you will never get one from the United States government. You might get one from, some state governments are doing it, but many states are not, right? So if you want to ever verify a vaccination certificate from someone from Texas, just to, pick a state, you're not going to get it from either the federal government or the state government, but you could get it from the hospital, a trustworthy hospital. You could get it from Walgreens or CVS or one of the large pharmacy chains that have administered a lot of vaccines. So it's very important, in our mind, to ensure that there's a registry, a network registry of issuers, not just government issuers, but also trustworthy health institutions. If you think about testing, some countries, I think a minority, many countries are issuing national vaccination credentials. Very few countries are actually nationally issuing test results, right? So if you actually want to be digitally verifying test results, you're probably in most instances not going to get that from a country, which means you want to be able to check a certificate that was issued by a trusted testing lab. So I just think it's really, again, clearly governments on the issuance side are important in many respects, but they're not the only ones. And if you actually want to, again, testing is probably the best example. Most countries do not have national databases of COVID-19 test results. So it becomes very important to be able to verify a credential issued not just by a government, but also by a trustworthy, reliable healthcare institution. So that's on the trust framework. On the solution side, which is CommonCheck as a solution, I mean, the smart health cards are an open standard. The registry is a registry independent of then the solution. CommonCheck recognizes that there are multiple standards, and countries are going to be accepting visitors from many different countries who might be bringing many different credential standards. So that's why the solution itself is not is designed to be able to verify basically all of the leading standards that are out there. And again, I think that was our big lesson learned. I mean, we launched Common Pass a year and a half ago, really, one of the first models of this. But we did that as a sort of an end-to-end solution because we needed to. But ultimately, kind of end-to-end solutions, don't really scale. You need to separate these different component parts, again, because not everyone is going to adopt one standard. And so that's why we've really, kind of really separated the issuance standard, the maintaining the registry, and separating it entirely from the verification of the CommonCheck solution, which is intended to be able to kind of verify all the leading credential standards based on an individual government's specific rules.
Thanks. That's very interesting. Before we come on to Michiel, I just want to say, I think you've hit the nail on the head there, that one thing is really important we have to consider in this discussion of digital health certificates is two sides, the issuance and the acceptance of them. And I'll come back to you on that in a minute. Michiel, if you can just address the original question, please.
Yeah, so thank you, Greg. So there were three questions really about reopening borders and how it's interoperable with other systems and how can it be as widely adopted. In terms of how our solution helps reopen borders, it comes back again to this question of trust. The trust framework in the EU DCC is a country-to-country model. So it offers, also with the inclusion of the validation rules in there, it offers predictability to the holders of certificates, and it offers certainty to governments alike that the certificate comes from a trusted source. And that's particularly, although, you know, I mentioned that the DCC was not developed in a border management context. It was done about freedom of movement, and within the EU, of course, you have borderless travel. For border management, of course, it does have the benefit that you know that the root of trust is in the CSCA, the country signing certificate authority, which is typically a ministry. And so that means that any certificate that is presented finds its original route back to a government-issued assurance, effectively, to say, look, we're behind this. And you know, Paul was talking about, you know, not all governments issue test certificates. I mean, that's certainly true. But the laboratories or the pharmacies or whoever, even across the EU, who are issuing these certificates, they, in their document signer certificates, of course, you have that root of trust, the CSCA. And so there you find the Ministry of Health or sometimes the Ministry of Interior back in there at the root of that, so that you always come back to that sort of national authority which is behind that, acting as a guarantor of that trust. So that does help reopen, because it builds confidence and trust in those certificates. And in terms of its interoperability with other systems, again, the EU DCC were not calling necessarily for one standard, not at all. Countries develop their own national solutions, but there is that flexibility that you can develop functionalities within your national solutions to ensure interoperability with certain regions. So if we take one of the countries that we're interoperable with, Singapore, for example, it has its developed national solution, and it's able to also generate a QR code that is EU DCC compliant. Likewise with the UK, although in the UK it's different because even their national solution is also based on the EU DCC, but they have an international travel version. And then they have a domestic version, and that also allows them to be compatible with other regions. So that is how we can ensure interoperability with other countries. And in terms of how you can ensure that it's as widely adopted as possible, I think there, from our practical experience, having an equivalence procedure allowing third countries to effectively self-assess and then onboard into our system allows its wide uptake. You know, as I mentioned, we already have 80 countries either connected or potentially connected, and each week we receive 1 or 2 new applications. So purely from experience, we say, how do we ensure that it's widely adopted? Well, it's an attractive system, so countries are seeing the value of that, and so they opt to seek equivalence in that respect, without necessarily saying, okay, domestically you need to opt for a different standard.
Thanks, Michiel, and thanks actually for all of you for answering that initial question. Donato, do you want to add anything yourself or lead into the next question?
Absolutely. I can see that we have 10 minutes left, so maybe we can start giving some priorities to the questions in the chat. And Greg, just a small internal note, Vinup has a commitment at 8:30, so maybe between now and 8:30 we can address one question, especially if the question is for Ayata, and maybe give the floor to Vinup for his closing remarks, and then we can address the other questions. What do you think, Greg? And please pick any question from the chat.
Yes, go on. Well, okay. The first question I see here is from Abutsa, and he says, how much safety is embedded in the process of digital vaccination certificate issuance, since it is required to register individuals' data, considering the whole process as novel as the COVID pandemic itself? How can we ensure the public not to be afraid of their data piracy or the privacy intrusion by hackers and so on? Any comments on that from our speakers?
May I?
Go on.
No, I mean, very briefly, as I mentioned, the only information that passes through the EU DCC gateway, for example, are public keys. So all the healthcare data and the personal data is stored in the QR code and only in the QR code. And so that's important so that it doesn't get transferred in an online way. And in addition, at the EU level at least, storage of such data after verification is prohibited. So there are very, very strong penalties attached to that if any such data is retained. And we also seek assurances from the countries with which we enter into agreements, also not to store such data after verification. So that, at least from the DCC point of view, is very strongly embedded into the system that is not retained.
I'll just build on that. I mean, that's very much the model, our model as well, right? I mean, when the Common Check platform is I mean, like you saw with the Cayman Islands, like it was verifying the certificate only for the purpose of checking against the rules, and then nothing is retained. The only thing passed then to the Cayman Islands traveler is, Paul satisfied your rules, thumbs up, right? A green check. So that is the only, that is the only thing that is sort of retained and sort of transitioned is but none of the underlying health information that was inspected for the purpose of checking against the rule is retained at all. Very consistent with Mikhail's point.
Okay, thanks. There's another very interesting question here. One of the challenges with this is from Haddon Wright. Haddon asks, one of the challenges with the different standards for digital vaccination certificates from the EU, ICAO, African Union, etc., is reading and verifying the QR codes. He says, I know public keys for these can be located at the ICAO PKD, Public Key Directory, for the ICAO Visible Digital Seal, or elsewhere, such as a national website. But it is an issue for border and health authorities in smaller countries in particular. I would be interested in the thoughts of the panel on how this would be resolved. Any takers?
Well, I mean, I'll start. That's why we built Common Check. We basically, because I think what we saw is we said some countries, started figuring out how to verify their own certificates, but then all of a sudden realized, wait a second, there are all these other certificates. So you don't just need to access the keys, you need the ability to verify, because they're different, basically they're different verification standards to be able to read what are different QR codes. So that was the whole reason that we developed Common Check, to do that service, was so a country didn't have to figure out, how do I integrate and verify all these different credential types, and then figure out where all their public keys are and ensure that they're actually still live and so forth. So that was the whole reason that we developed the Common Check platform, was to be able to remove that burden from countries having to basically integrate all of those different standards. Again, maybe eventually there'll be convergence onto 3 or 4, but right now there are about 30 different standards that we're verifying against, and including checking the public keys of all of the issuers of all of those different credential standard types.
Could I follow up on that?
Yes, go on, Mickey.
No, I mean, Indeed, the keys, the trust list, the common trust list is of course maintained in the EU DCC gateway, and that's only for countries that are actually have been vetted and screened to get through the system. But as the link that I've just put in the chat shows, I mentioned we have our open standards and specifications, but that also includes reference implementations for the verification software. And we haven't imposed a one-size-fits-all because each country has its own national verifier app or digital wallet app and so on. But we produce the common template for that, and any country can effectively take that and run with it and develop those their national issuance and verification and wallet apps on the basis of those specs. And quite a few countries have actually done that. So that is a way to overcome the obstacles, especially for smaller or less digitally mature countries to be able to use that so that they don't fall behind, because we felt that that was important, not just for some of our member states, but also third countries.
I've also just put the Smart Health Card Verifier specs in there as well. Similar principle. Again, I think the challenge though is those countries then need to implement a certain spec for EU DCCs, a certain spec for smart health cards, another one for DVOC, and so forth. So again, it is there are tools to verify each of the open standards, like EU DCCs and smart health cards. You still though need to then implement different integrations of each of those different verification solutions if you want to be able to verify more than just one standard. And again, that's what led us to Great Common Check, was we basically thought that was hard to do, across, given the multiple, credential types.
Thanks. Very excellent answers. Donato, do you have any comment?
Not comment, but I would like to give the floor to Vinup, because I'm sure that
Yes.
he has a couple of words, and then maybe the final remarks. Over to you, Vinup.
Yeah, thanks. So, I think one of the things is public keys are not very public. And I think that is one of the issues that many in the industry face, especially when airlines or airports are expected to verify credentials. So one of the things we have ended up doing in the IATA travel passes, while we as IATA, we fully promote and support the EU DCC, and we are actually, and Michael will be happy to learn, I have my team talking to governments in Asia Pacific, trying to convince them to implement EU DCC and trying to point them in the right direction. But then in the IATA Travel Pass, we also understand that there are other countries that have implemented or implementing the ICAO VDS or the DVOC. And so rather than leave that again, the issues of having governments or other entities to try and verify, read and verify these different ones, we have decided to implement that functionality within the IATA Travel Pass. So the IATA Travel Pass will be able to read EU DCC certificates, DVOC, Smart Health, ICAO VDS, because that's the nature of the beast for airlines, right? If they are going to operate in multiple markets, they have to read the different certificates that are out there. It's just, we can wait and hope that most they will converge around one standard, but our focus is to get the industry restart and people flying again today. So we have had to implement that within the IATA Travel Pass functionality. Just wanted to make that comment. Thanks, Donato.
Thanks, Anup. It seems to me that, as I mentioned earlier, the key challenge here, I don't mean to lessen the importance of the issuance of digital health certificates, but it seems to me that the acceptance is the bigger challenge. And if you look at some of you are familiar with the issue of how the ICAO e-passport was developed and launched, which was quite a long time ago now. And back 10 or so years ago, there were many countries issuing the ICAO e-passport and far fewer that were accepting it, or at least they were far fewer that were actually reading the chip in the passport and checking the keys against the EKD. So do you think we're going to have the same issue here? We're going to have a lot of digital health certificates, whether they're based on the WHO standard or other standard, a lot of digital health certificates for vaccination certification, test result certification actually issued, and there's going to be a long pickup before the acceptance is as broad as the issuance. And is there any solution to that? I mean, obviously, we have two organizations here that are developing ways to accept, and Paul, you're trying to find, you're apparently accepting as many as possible. But do you agree that the acceptance is the biggest challenge, and the acceptance is what we need to work on at this point in time?
I do. I also think it really depends on whether or not countries care. And I think if we think about you think about the current status, there's some countries that are very rigorous in terms of verifying, and some that are, basically said, hey, we're going to put this burden on airlines, and we'll, rely on airlines to do the checking. I mean, we think about the last week with the emergence of the Omicron virus and the news I'm sure all of us have seen. There were the two flights, the two KLM flights to Amsterdam, 600 people on the flights. It turned out that 60 of them tested positive when they got tested, and 13 of them with the Omicron variant. There was a quote from KLM, the airline, that said they'd all produced proofs of vaccination and testing before they boarded. So I think verification of these digital credentials will happen, when, as countries basically determine that it's actually really important from a sort of public health and health security perspective, that it's important to actually check in a reliable, robust, tamper-proof way. And I think, scenarios like those KLM flights, like my experience flying has been, the idea that an airline check-in agent looking at a piece of paper of a test result in any language is actually a reliable way of ensuring that someone, actually got tested, is just not reliable. Now, again, not every country cares that much, and some countries are, seem comfortable with that. But I think as the pandemic, if we get more, it depends on what happens with Omicron, frankly. And if there is urgency to actually really ensure that someone, the technology and the tools are there to actually have end-to-end verifiability, put it that way. If there's an interest and motivation to actually care, then the tools will get adopted, and I think the verification will scale. Right now, there's a range of motivation in countries to verify. For countries that are very concerned about verification, the tools are there, and I think we'll see more adoption. Unfortunately, with emergence of new strains like Omicron, I think you will be likely to see more, because the problems with the, hey, just let the airline check-in agent look at a piece of paper is just not going to be satisfactory to actually help overcome the challenges.
Yeah, I definitely agree. Donato, any comments?
No, thank you, Greg, but maybe we can go in the chat, because I see lovely questions in the chat. Maybe we can start from Solomon from Fiji. He posted 2 questions, and maybe I can start alerting Nat and Michael, but of course the panelists can also contribute to the answers. Are there any efforts or discussions by different agencies and countries to standardize different requirements? COVID certificates and health status verification tools, ? And there is a second interconnected question. Will these new tools be able to accommodate also vaccination status for immunization of other viruses, such as measles, polio, yellow fever, etc.? So a common vaccination card. And this question comes from Solomon, and good night, Solomon. It must be very late in the Fiji. Nat, do you mind to start addressing the questions?
Sure. Actually, I'd also like to comment on the second question that Greg had posed earlier in regards to the yellow fever certificate, the yellow card, because I think all these kind of fundamentally come down to the same issue. So with the international health regulations that was established, ratified in 2005 by 194 state parties, they had outlined essentially a list of data elements that would be required for a vaccine certificate that is required for yellow fever and polio when entering into polio and yellow fever endemic countries. And I think it's important to note that that was all pre-digital. Obviously, 2005 was a very long time ago, and those who did travel with the yellow fever certificate on paper can attest to the fact that yes, everyone had them, and yes, they were standardized in a way that they may or may not have the WHO logo on it, oftentimes on a yellow piece of paper and had stamps. But the way they were verified was essentially just someone looked at it and they were either okay or not okay to go. And it was very fraud prone. And so I think the reason why that hasn't translated as easily in digital space and kind of the ongoing discussions with standardization around this certificate, I think it's just a microcosm of the grander picture of lack of global cooperation in addressing this pandemic overall. Right, because it's not just about the interoperability certificates for international travel, but even sharing of surveillance data, sharing of genetic markups of the various virus variants. These things are still very much real issues, and they just highlight the fact that in order to come together as a global community, there needs to be some sort of legal agreement across all of them, similar to what the international health regulations had established, what is being discussed right now at the WHO special session on the pandemic treaty. And I think, yes, as a group of technologists, people in digital health, people in border patrol, there's only so much discussion we can do when it comes down to the fact that countries have not agreed upon what they define as trustworthy. In our discussion with member states, there are some member states that said, well, for a test certificate, we want the name and address and phone number of the test center, because the way that they feel that they can trust that certificate is by calling up the test center and asking them. And for them, that is how they establish trust. Whereas in other countries, especially those that are more technologically savvy, say, no, we need to have a private key infrastructure. And other countries need to have some sort of blockchain verifiable credential. And all these things, I think, have just accumulated into these varying and separate digital systems, but they stem from very real political discussions that have not taken place. And I think it's important to highlight that the success of the EU certificate is simply because they actually had all these global cooperation agreements decades before in setting up the EU, right? And setting up those legal agreements to say, yes, we trust each other based on all these things prior before COVID even came around. So I think, hopefully what we're building right now in terms of technology will definitely be applicable to greater data sharing across countries, especially when it comes to individual health when they cross borders. But at the end of the day, until countries agree upon exactly how they can trust each other, then I don't foresee this, unfortunately, going any other way. Because even in the paper system and the analog system, like you mentioned with e-passports, even with, say, with visas, right? Individuals from some countries still need visas to get into others. And so there isn't this global agreement at this point yet at a very real geopolitical level that there's no amount of technology that can solve that. So just wanted to, that will be a statement as well. Thanks.
Thank you very much, Nat, for the very comprehensive answers. I'm looking also to other panelists if you want to add anything to Nat's reply. If not, we can move to the next question.
Maybe just a small addition. It's certainly true what Nat was saying at the EU level. We've benefited from two platforms in particular. One which Nat sort of implicitly referred to, which was the eHealth network, which was set up under one of the cross-border healthcare directive, which had already existed for 10 years prior to that, and that's specialists and experts in digital health and in eHealth who have been coming together over a long period of time. So there was already a network of experts who knew each other, which I think really helped expedite the process. And then, of course, we had the digital contact tracing apps in the immediate run up to the DCC. But in terms of the broader question about, what other possible uses, I mean, there are three sort of key regulatory developments at the EU level at the moment, which the DCC can offer potential use case for. One is the revision of the eIDAS regulation, which is all about electronic identity. And in fact, they've already announced that they want to use healthcare as a use case for that, taking inspiration from the DCC. And then, of course, you also have the Digital Services Act and the European Health Data Space regulatory initiatives at the same time. So we're seeing a convergence of different initiatives at the moment where the potential for using these kind of digital tools in a broader context to potentially, materialize in the coming years. So we think that holds out great promise, but it's a slow process. It's a very rigorous one because there are so many factors that need to be taken into account. But seeing the acceleration of the development of digital certificates across the world, I think holds out great promise for its potential in other use cases.
Yeah, I'll just build on that too, because we're already seeing it. It's already happened. So again, I don't want to get too deep into the, kind of design spec of credentials, but basically what the smart health cards approach was to take HL7 FHIR, which is sort of the data definition taxonomy for health data interoperability that is relatively broadly accepted around the world, and basically just say, all right, we're going to take some of that, initially the data type related to COVID vaccine and COVID diagnostics, and put it in a verifiable credential envelope. But it was designed to be able to then do that with any of the standard HL7 FHIR data. So many of the states in the US, like California and others, are already using this to issue smart health cards for routine immunization records, not just COVID, but other immunization. Rwanda is doing the same thing, right? So but they're also starting to put other types of health data in, health insurance coverage information, all sorts of other health information in the same package. So it's not a future thing; it's already happened. That people are, and again, this is hopefully one of the positives that can come out of this terrible pandemic is, an acceleration of the adoption of some of these tools that can really, enable kind of health data interoperability and unleash the potential of, digital health solutions to improve health, health access around the world. I mean, that's certainly, I've spent the last 25 years of my life in digital health and health data, and never have you seen such rapid adoption of open interoperable standards. So I think it is, there is an opportunity to sort of make lemonade out of the lemons of the situation, and really accelerate the cause of open health data standards, interoperability, again, not just for COVID and border reopening, but to really, transform and improve health around the world.
Thank you very much to the panelists. Greg, I look at the time, and actually the time is technically and formally over, but we have three very interesting questions in the chat. So if you and the participants agree, I would like to read them loud to everyone. So let's start from Monica Weber. Nice to see you online, Monica. And maybe this question is for Michael and Paul, but nothing stops Nat from also contributing. How flexible are the COVID digital certificates regarding storing data? Example, I received the first COVID vaccination in Australia, a second in Austria, and a booster in Thailand. Can these be stored in one single digital certificate, or I will need to continue with proving the vaccination status by paper over?
Paul, would you like to go?
Yes, please.
Go ahead.
Okay. No, I mean, I was actually answering a question in the chat, which touches on a similar kind of question that you just raised, Donato. The member states produce different apps. For some produce just verification apps, like here in Luxembourg. Other countries produce sort of have very integrated wallets where you can also retain your certificates and even have family functionalities on it, so you can include more than one person. So that's very much a flexible system in terms of how each country chooses to do that. Some of these apps are downloadable even outside the country. For example, I use the German Corona Warn app for storing my certificates, and that is then possible to present my certificate in any other country and have that verified. And the Corona Warn app also includes all of the validation rules that are uploaded, so then you can select which country you're traveling to and see whether your certificate meets the conditions in that particular country. So there are no plans at the EU level to create a single type of storage app. I mean, that's certainly possible, but as I just pointed out earlier, retention of that by verifiers, that's not possible, and that's prohibited. Paul?
Yeah, I think it's always important to separate these steps in the process, right? There are multiple wallets, like the ones that Mikhail mentioned, but also like Apple Health and they're effectively wallets where you can hold multiple pieces of health data, including different multiple certificates of individual vaccinations. I think one of the things that is been confusing is sometimes people conflate, I have a vaccine certificate to I'm quote unquote vaccinated, and ultimately the definition of what vaccinated is or what fully vaccinated is will vary country by country, and it's changing, right? And at some point maybe it says, well, you need to have had a booster within the last 6 months. So I just think we really separate. So to answer the question, yes, there are wallets where you can store multiple credentials, multiple records effectively of those individual vaccinations. But then it really is up to the verifier to say, okay, are these 3 credentials that you're bringing with you, do they satisfy the rules to enter my country or qualify as being vaccinated within, based on the requirements and the definitions of what vaccinated means in the jurisdiction. And it's important to separate those 2 things, because otherwise it gets really confusing.
Thank you very much. We have another question from Sri Lanka. Is it possible to integrate the UDCC to the e-visa, the electronic visa request? And maybe Michael, do you want to start?
No, that's kept. It was very deliberately kept separate from what we call the Schengen acquis, which is an awfully bureaucratic term to delineate sort of immigration and border policies from the EU. As I said, the legal basis is in the freedom of movement. It is not in immigration and border control. So obtaining an EU DCC compliant certificate has no bearing on the entry conditions to the EU, and it is not an entry condition in itself. What it does allow the holder to benefit from is whether particular restrictions will be waived or not upon entry. But there is no plan to have any kind of integration with the e-visa as such. I know that there are ongoing discussions about finding a better way to align the EPLFs and the DCCs, but not that I know of for the e-visas.
Thank you very much, Michiel. Anything to add from other panelists? If not, we have another very interesting question from Franz Pruch. And actually here, again, the issue of a verification comes back into discussion. How would you address the problem that verification of the certificates is mostly done, if at all, just by checking if there is a QR code without even having the possibility to check the information which is embedded in the QR code? In this context, I see more harm done by introducing electronic solutions to travelers who do not have access to high quality services, vaccine, licensed health facilities, etc. The ICVP worked for centuries just fine, and now we promote island solutions for individual developed countries while others are kept out. Very long question, and I hope it is quite clear for the panelists. Who would like to start addressing this?
Yeah, I'm happy to jump in because I was very much involved. I mean, look, some certificates, people are just holding up a phone saying, look, I have this thing. That's no different than me holding up a paper CDC card. Again, if a verifier doesn't care, they don't care. However, there are a lot of countries that do care. I mean, I showed you the common check system for the Cayman Islands. Like they're reading that QR code, and you're only going to get a approved if the QR code is has vaccination information that's consistent with the guidelines. And we're working with Singapore as well. Singapore has the vaccinated travel lanes. You don't get in Singapore unless you have uploaded a QR code that satisfies the requirements based on those Singapore rules. So, they're absolutely, QR codes aren't being read in every scenario. I mean, if, I go to a restaurant in New York and they, maybe they would glance at the app, but certainly in scenarios where countries are rigorously enforcing health screening requirements, absolutely those QR codes. I think the reason why not go to paper, it is not feasible. It is not, it's not reliable, it's not trustworthy, and it's not feasible to operate at scale. I mean, I think we've all seen the news reports of the sort of, the processing times. I think our IATA colleague talked about this, the processing times and backups at airports and border control, immigration with burdening either airline check-in staff or border agents with having to look at, process lots of pieces of paper isn't scalable as travel resumes to normal volume. So anyway, that's sort of I think my comments on that.
Yeah, if I can, oh, go ahead, Nat.
No, I was just gonna say, I kind of addressed some of this in the Q&A section as well, but maybe just to elaborate more. Definitely agree with Paul's point. Different countries have different acceptance mechanisms, and it's inherently up to that country to decide how they want to do that, if they care if it's digital or not. And in terms of whether or not WHO can issue a recommendation on this, I think I just want to again clarify that WHO does not recommend that COVID vaccination status as a requirement for travel. However, countries may use it as a mechanism to reduce public health and social measures like quarantine times and testing requirements. So it's really up to the country based on their epidemiological situation to decide how they want to do that, and also based on their capacity to do that. Because if countries say have their health system in place, have their contact tracing systems in place, and everything is robust and able to support an upsurge of COVID cases, then there really is no need for COVID certificates in the first place, right? And some countries that have gotten that capacity up actually have reduced those requirements to none. But I think just to reiterate too, the reason why it's very different from the ICVP and the case of yellow fever is that there were only a handful of countries that required yellow fever vaccination to enter their countries. And there's only 1 or 2 yellow fever vaccines that are accepted under WHO legal requirements, which is the international health regulations. And there's only very few people from countries that would not have yellow fever that would travel to yellow fever endemic countries. But with COVID, the scale is massive. It's everywhere. It's everyone. The number of vaccines is significantly more. And also the fact that people are getting vaccinated at a rate that is unprecedented and incomparable to yellow fever, right? Because with yellow fever endemic countries, that was part of their national immunization program. So you get vaccinated as a child. If you're traveling from, say, the US to Brazil, how many people within the US are actually getting vaccinated for yellow fever? Very few, and they can only get it from a handful of CDC approved travel clinics that have that vaccine. Whereas with COVID certificates, there's literally tents and mass vaccination programs to vaccinate everyone because the entire scale is completely different. So I don't think it's really a one-to-one comparison with the trust framework that is established under the international health regulations for yellow fever at this moment. And I think it's really important to keep that in mind. So that's why at the end of the day, with the science constantly evolving with new variants coming up all the time with different vaccination rates within each countries and different epidemiological situations, different health system mechanisms for pandemic management. There's absolutely no way that there's a one-size-fits-all solution in this case. Over.
Can I just add briefly, just coming to the question as well. I mean, it says just by checking if there's a QR code without having the possibility to check the information which is embedded. That's not necessarily how it works, of course, because what is read is not necessarily the same as what is displayed afterwards. So in the process of verifying, of course, all the information, including the vaccine type and the product, because certainly in the EU, different member states have different acceptance of which vaccines are valid in their territories. So even if what is on the display might just be a red or green with the person's name, doesn't mean that the other information held in the QR code is not read in any way. In fact, quite the opposite, because it's integral to the acceptance of the certificates in the first place. So it has to be read in order to know whether to allow the holder, whether they can have restrictions waived or not.
Thank you very much to the panelists for the answers. Greg, I'm looking at you. I think that we run out of time. We are very beyond schedule, and we do not want to keep our speakers and our attendees on this call for long. Maybe we can start closing. What do you think, Greg? Over to you.
I totally agree. I mean, I think we're nearly 30 minutes over, and we still have a few questions in there, but I think we have to call it a day at this point. So yes, I think it's been a very interesting session. Honestly, I think we've only scratched the surface of this topic. And as we said at the beginning, these Road to BMIC webinars are intended to set the scene for discussions at the actual 6th BMIC conference at the end of December 2022, or in December 2022. And I think we'll certainly need to have come back and address this subject again, because there's clearly a lot of things that weren't addressed here. And by the time we get to a year from now, there's probably going to be a lot more to discuss as well. Back to you, Donato.
Thank you very much, Greg. I will be very short here. Excellent presentations, excellent discussions, fantastic questions, and actually thanks to all of you. We will have more to explore in the next webinars, and you all will receive information for the next webinars. And we all hope to see you in the in-person Border Management and Identity Conference 6th edition in Bangkok in 2022, December. A personal but also collective thanks to Nat from the WHO, the World Health Organization, Paul from the Commons Project Foundation. Vinu, by the way, had to leave for another commitment, but of course we thank Vinu for his presentation from IATA, and last but not least, Michael from the European Commission. Thanks for your for participating to this first virtual webinar that started paving the road to the virtual webinars that will follow, and lastly to the in-person event in December 2022. And a special thanks maybe for the colleagues that are in very late evening time, but also Paul, night time. And see you very soon in the next virtual webinar. Thank you, Greg, for your presentations.
Thanks, Donato, and thanks again to all our speakers. Thanks very much, and to all the participants who tuned in, and I hope you found it useful. We'll see you back in the next Road to BMIC webinar at the beginning of 2022. Thank you.
Thanks all. Bye.
Thank you. Bye.
Thank you. Bye-bye.
Thanks. Bye-bye.